the other factors that can increase the likelihood of developing acne scars?
There are many factors if you have to look at. Sometimes what happens is acne scars we can start from blemishes to ice pick scars to box scars. It depends on how big the lesion was and how it healed and what you have done, the treatment, what has been intervened, and all those things play a role. So what happens is if you are out in the sun and you're not using a sunscreen, then obviously the dark patches are going to increase, so you're going to have more blemishes than ever before. And then what happens is if you are picked, then there is a problem. And if you have nodulocystic acne and you're just trying to apply, the nodulocystic acne I like to explain is what you have like big lumps in your cheeks, you just want to squeeze the thing out and you feel there's something filled inside. Many a time they'll say it is pus, and if you remove the pus it is going to heal. But in that case then it's going to be a worse scar. But if you go to a dermatologist or a doctor who's going to handle it, then there are some good techniques to handle such nodulocystic lesions also. So initially to begin with, you can they will inject a little bit of a steroid inside the lesion so that the inflammation comes down drastically, and that will help the scarring a lot, manifold actually. So that at times they don't even scar if they heal well. Then of course you might need an antibiotic for a short time. And then if your skin is very prone to these kinds of large nodes or nodular or nodulocystic acne, then the doctor would prefer to start you on something called isotretinoin. You cannot have it without a prescription, so you should follow what the doctor prescribes at that given point of time, follow it up well with them, and it will be given for a stipulated period of time, anything between 3 to 6 months depending on what your requirement is, and the dosage also will be depending on that. So when you do that, what it will do is it will shrink the oil secreting glands quite a bit. So in the future you will not get that, and your scarring rate will be much lower. So the best bet is to run to your dermatologist.